Hi guys, just going live here on Instagram, and hopefully that's working too. How's everyone doing? Okay, I think we're live on all forums. Hi guys, how are you? So happy and excited to be back to yet another live installment of live Q&A questions. I have people throughout the week put questions on our group, which is a free educational forum, but also message me directly with questions. And so I like to address these questions in the form of a class. This is again, it's not medical advice, it's just educational information. But I really love doing these because when I get these questions, I get fired up. You don't get just a simple like one word answer with me. You're going to get like a really drawn out scientific explanation of what's going on and why things happen. And so I love doing these classes for that reason. So somebody reached out to me by DM earlier in the week and basically asked me, I've met them in a different group and I had posted a comment in a different group, and they had asked me to talk about insulin resistance. How can they prevent their insulin levels from fluctuating? And how all of that has an impact. So I thought this was a great question and a very, very important one. And we can do today's class on insulin resistance. And I can really talk about it because you are starting to hear it a lot now where people are talking about insulin resistance. It's really up and coming now, that word, and like how it affects. I really like it because in the functional medicine world, we have been talking about fasting insulin and insulin resistance for over 30, 40 plus years. Medicine now is catching up and all of that stuff, but it is the cause. Elevated insulin level is the cause of 8 of the most common diseases today, including diabetes, PCOS, hypertension, cardiovascular disease, cholesterol issues, fatty liver, what else? Inflammation, cancer. I mean, elevated insulin levels are the number one cause of 8 of the most deadly diseases today. Yet, when you go to the cardiologist, they're only taking care of your, heart and giving you cholesterol medications, or even in the case of like, if you're going for diabetes and you're given diabetes medication. But when you see that all these diseases under the umbrella of an elevated insulin, then why not address the root cause? This is what I love about functional medicine, that if you can get to the root cause of disease, you can fix it versus band-aiding and just, giving medications and supplements and things like that. So today I really, really wanted to focus on insulin resistance and how elevated insulin is the cause of 8 of the biggest diseases today. And if we can bring that level under control, then you really would be prophylactically or preventing some of these major illness and diseases, and even potentially getting off medication. I have been able to very successfully work with my patients and their physicians and practitioners to be able to hand in hand work together to get them off diabetes meds, blood pressure meds, cholesterol meds, simply by doing lifestyle medicine, practicing, functional medicine, getting to the root cause, and really helping them with the help of their practitioner to get off these medications, not only temporarily, but for life, so they don't have to deal with it again. So today, like I said, we're going to talk about insulin resistance. And what is insulin resistance? So insulin resistance is when the cells, the muscles, they cannot uptake glucose. And so what happens, because you need glucose to function, to think, to run, to sleep, you need glucose. So what happens then is that the pancreas then produces more and more insulin because it realizes that, okay, the cells need glucose, but they're not absorbing it. So we have to produce so much more. And so over time, this number really starts going up. So one of the biggest tests that doctors today are not doing is a fasting insulin test. And the reason for that, I don't know why it's not being done, but it really should be done. And the reason for that, why it should be done, is because let's say you and I both go get blood work tomorrow morning. Your fasting glucose level, which is what they do, let's say it's 99. And my fasting glucose level tomorrow morning is also 99. However, you need 20 units of insulin to keep you at 99, and I maybe need 6 units of insulin to keep me at 99. So you can see that both of us have fasting glucose levels of 99. And if we went to our doctor, the doctor would say, oh, well, you're good. Your numbers are good. You look great. But behind the scenes, there's more stuff going on that can be dangerous. So if you have a fasting insulin level of 20 and my fasting insulin level is 6, then I'm going to fare much better and hopefully be able to prevent 8 of those big diseases that we have today. So that is the number one test that doctors are not doing. When they are checking your fasting glucose, they are not checking your fasting insulin. That is if you go to the doctor and you're getting blood work, then you need to push for fasting insulin. And in the functional medicine world, we like to see those numbers 6 and under. And especially for healing from chronic illnesses, the client that I was working with earlier in the week, she's an adrenal fatigue patient. And I really emphasize keeping blood sugar levels steady with adrenal fatigue patients, because you will see a remarkable difference in their healing. And so any kind of chronic illnesses you can really treat by just bringing your fasting insulin under control. And then, when you go to the doctor and they say, oh, you're 99, or you go back a year later and they're like, okay, now you're 104 and now you're 110, they're going to tell you that you're pre-diabetic or that you have metabolic syndrome. The problem is, at that point, you already have it. And so it's really tough to backtrack, versus if you've been testing the fasting insulin all along, then when that insulin is starting to creep up from 6 to 8 to 10, you get up to numbers of 10, we know that we've got to bring it back down. And so with all my clients, not only do we, recommend that they get their fasting insulin levels done, but I put all my clients on a continuous glucose monitor, even if they're not diabetic, because then we can really monitor what is going on with their blood glucose levels throughout the day. And you'd be amazed, about 98% of diseases can be cured this way, just by managing the fasting insulin. But above all, you can lose weight by managing the fasting insulin levels. So who wouldn't want to do that? So let's talk about it a little bit more. So insulin, is a direct factor in weight gain. So Ben Bickman says you cannot make fat cells grow unless insulin is elevated, even if you have excess calories. So let me repeat that. You cannot make a fat cell grow unless insulin is elevated, even if that fat cell is swimming in a sea of calories. So what does that mean, right? So you could be having excess calories, but you're having the right kind of stuff, and none of that excess calories that you're having is raising your insulin levels. And if that's the case, you're not going to gain weight. Now, on the flip side, you cannot make a fat cell shrink unless insulin levels decrease, even if you're in a calorie deficit. So you cannot make a fat cell shrink unless insulin goes down, even if you're in a calorie deficit. So what that means is that you can diet all you want and be in a caloric deficit all you want, but you will not shrink that fat cell and lose weight unless you bring the insulin levels down. And so how would you bring your insulin levels down? And this is kind of a discussion that I was having with that patient, as far as high protein, high fat, and high carbohydrates. High fiber. So high protein, high fiber, and high fat, right? All of those, macronutrients keep your blood sugar level steady. The moment you introduce carbohydrates, and especially refined, flours and pastas and breads and things like that, you spike up your blood glucose level. And when that blood glucose level goes up, then your body is going to have to produce insulin to bring that blood glucose level down. So the more you're having those items and carbs and heavy carbs and things like that, the more your body has to keep producing insulin to bring that blood glucose level back down. And so that's where we're talking about the elevated insulin causing 8 of the most significant diseases today, but also significant weight gain. So with my clients, and when they work with me, they start losing weight very quickly because we need to bring that insulin level down. Once you start bringing that down, and once you are more of a steady, state of glucose and steady state of insulin, you will start losing weight. Because according to what we were talking earlier, like I said, Ben Bickman said, you cannot make a fat cell shrink unless insulin goes down, even if you're in a calorie deficit. So you can be in a calorie deficit all you want, deprive yourself all you want, but you will not lose weight, right? So let's talk about this a little further. So if you have too much insulin, then your body needs a lot more each time to absorb and to be able to take up that insulin, right? So you're developing what's called insulin resistance. That means your body needs to produce more and more and more insulin every time to be able to suck it up, use up that insulin, and use it for whatever it needs. So that's called insulin resistance. On the flip side, which is what we want, and I strive with all my clients, is insulin sensitivity. So with my clients, we work on them needing the least amount of insulin to do the same job. If you go back to our earlier example where I said, your fasting glucose tomorrow morning, you and I both go to blood work, and your fasting glucose is, let's just say 99, and my fasting glucose is 99. However, I need 6 units of insulin because I am insulin sensitive. So my body just needs to produce a little bit of insulin and the job is done, right? So that's all I need. And it can prevent me from getting any of these 8 major diseases, even decrease inflammation. But the less the insulin, the smaller my fat cells. So I don't have a problem maintaining my weight, and I don't have a problem losing weight if I was looking to lose weight. So how do you increase insulin sensitivity? And this is where my clients work with me to get phenomenal results, because this is what we are focused on in our day-to-day as we're working together. So how to increase insulin sensitivity? I'm a big fan of intermittent fasting, extended fasting, huge fan, because what that does is if you're eating your calories only in a set window, if you're intermittent fasting and you're only eating in an 8-hour window, then your insulin is only having to do, spikes and up and down in that 8-hour window. Versus if you're eating for like 16 hours and you're snacking late at night and you eat breakfast first thing in the morning, your pancreas has to produce insulin throughout the day. So you're going up and down from 7 a.m. all the way to 11 o'clock at night. So that makes you insulin resistant. What you really want to do is practice some form of intermittent fasting, or extended fasting for that matter, with your practitioner, and we can start making the cells of the body more insulin sensitive. The other thing that we can do, and that I work with my clients, is I provide a complete meal plan of what they're going to be eating breakfast, lunch, and dinner. Not only do we practice intermittent fasting, but then I provide the meals of what I want them to eat, because they will be high protein, high fat, and then high fiber. So that will help your body not spike and produce so much insulin because your blood glucose levels are not going up. So the other way you can get more insulin sensitivity is, like I said, fasting, and not, all day, but then also exercise. Exercise is a big way to also, because your cells start using up the glucose, the muscles, to run, to exercise, to lift, whatever you need. And so for that reason, your body then starts getting insulin sensitive because it only needs a little amount of insulin to do the work that it needs to do. But this is why across the board, my clients all wear a continuous glucose monitor, a CGM. This is why they wear that, because then they have real-time data when they can see that, oh, I ate, this slice of pizza, and this is what it did to my blood glucose level. Oh, I ate, a piece of cake, and this is what it did to my blood glucose level. So over time, as you're getting that visual feedback, you start realizing, like, these are the good foods and this is what I can do, but then these are some of the bad foods and I cannot eat that. Now, don't get me wrong, my clients that work with me don't not have a life. They have a life. They do eat some of those sweets and things, but I teach them how to eat it So for instance, if they're going to do a small piece of cake for a birthday celebration, then I will have them eat a high protein, high fiber meal beforehand. And then they will eat the cake. So that spikes their sugar a lot less. I call it dressing your food or something like that. But that's really a big way, that we do that. We do intermittent fasting. Fiber is huge. Fiber actually makes like almost like a sludge in the gut lining. So if you start with fiber, it makes a sludge in the gut lining. And so then when you eat whatever it is, that pizza, pasta, cake, or whatever, the sugar, the glucose is not rapidly absorbed into the bloodstream because you've got this sludge forming the lining. So I really push my patients, especially when they go out to eat, to really start with a big salad. So I'll give you guys an idea. I'm not a big, I don't even eat gluten anyways, but I never have liked pasta, pizza. Like it's just not in my diet that I like to eat. Now, once in a while, my kids and my husband, they really like pizza. So this past Saturday, and I wear a CGM, this past Saturday, we went to a pizza place. And so what I ended up doing was ordering a huge salad. It had like arugula and asparagus and like all these beautiful green veggies. And I had a whole plate of the salad. I mean, anyways, I was craving salad just because the salads at this place are so good. So I had this whole plate of salad. And then I did have gluten-free pizza, but I had, I think 3 slices. It was small slices. But even my pizza had like onions and mushrooms and peppers, and there was all the kale. It had actually got kale on it. I know it doesn't sound great, but it was delicious. So even my pizza had so much fiber. But the fact that I started with this big, salad that really formed the sludge lining in my GI system really allowed my blood sugar not to spike at all. So I think when I sat down to dinner, I was probably like, let's just say 120, but I only had a 30-point spike in my blood glucose level. So I only went to 150 and it very rapidly came down. So those are some of the trends that we're looking for, because you want to make sure that not only is it a quick spike and comes back down, but it's not staying elevated. And the fact that I only had 30 points, spike is amazing for 3 slices of pizza, which I would sometimes get a 30-point spike if I had like some cake or some ice cream or something like that. So very, very amazing. And so these are the kind of things that I will teach my clients when they're working with me, how to prevent these spikes. And the more you prevent these spikes and insulin spikes all day long, you start losing weight. Your inflammation goes down, so your joint pain goes away. You start having, because you're less inflammation, so muscles don't hurt. You have more energy. You have, you don't have breathing issues and things like that. Your cholesterol starts going down. Your blood pressure starts going down. And this is how we can get these clients to then lose weight, get off their medication, feel better, have all this energy. And so really very, very important to make your body insulin sensitive. And the one last quick thing that I want to talk about is insulin resistance and aging. And when I talk in relation to aging, I mean aging for men, but also aging for women. So aging for women does mean perimenopause, menopause, of course, because that's, part of our cycle. For men, it's just more regular aging. So you become more insulin resistant as we age. The reason for that is because sex hormone production is really going down. Some of your hormones are really affected, like thyroid and things like that. So you start becoming more insulin resistant. And the reason for that is because even in men, but specifically in female who are perimenopausal and menopausal, your estrogen production goes down. So what the body does is that it starts holding on to fat cells, because fat cells are the ones that help produce more estrogen. As your sex, gonads and ovaries and all of that stuff is starting to retire, then your body still needs estrogen. So producing more fat cells is how the body then keeps up with that decreasing shortage of estrogen. And so that's why we start gaining weight in our later years. And so you hold on to fat cells. The other thing that also happens with aging is male or female is high stress levels, high cortisol. So when that happens, your body becomes more insulin resistant. So when you have high stress, increased cortisol, epinephrine, adrenaline, all of those things make your body more insulin resistant, because your body thinks tiger situation, we better hold on to some fat and some glucose, because we're going to need it. We're going to have to run from that tiger. So high stress, increased intake of caffeine. This is why, like, I really, really try to minimize my clients and how much caffeine they have, and coffee and things like that, because coffee stimulates the production of epinephrine, norepinephrine, epinephrine, adrenaline. So coffee stimulates that. And so that's going to cause weight gain. And so really try to cut that down, but decrease their stress levels, make sure they're sleeping better. Like I said, decrease sex hormones in men and female, but also sedentary lifestyle. As we get older, you have these desk jobs, you're sitting around all day. It's not like kids when we were running around all day and playing and bikes and hanging out, and we're just more sedentary, less exercise as we get older. I mean, yeah, you go 1 hour a day, but like 5 hours, a week is really not that enough. I'm not saying you have to exercise more, but what I'm saying is you do need to be more active and walk around more, take the stairs more. If you have a sitting job, stand up, do a couple of, physical jumping jacks or push-ups or things like that every hour. So preventing more of that, where you're just constantly sitting, and then a sedentary lifestyle, decreased, exercise, things like that, will make you more insulin resistant. So these are all different ways that, again, we have a very set schedule that I work with my clients to help decrease, insulin resistance, and to really get them to where they are losing weight, decrease inflammation, so they have less joint pain, less muscle aches, less injuries. It's huge, huge thing to see when you decrease the inflammation. The other thing that I think, as we age, obesity is big, so causes insulin resistance. Your diet is changing, that causes insulin resistance. Alcohol intake really increases, so that causes insulin resistance. So there's so many factors. And so when a client comes to me, we take all these factors into consideration, versus just, okay, here's, metformin, or take some diabetes pill or something. Take all of these factors into consideration, give the patient the tools that they will need to then help with weight loss, balancing hormones, increasing energy, decreasing joint aches and pains, things like that. It is all a combination. And the good thing is that this is more of a permanent fix. So the reason this is called HCIL, Healing Chronic Illness and Longevity, is because I focus on longevity. I don't want to teach you just in the here and the now. When you're working with me, I want to teach you how you can do this for the rest of your life, so that you can be 60, 70, 80, 90 and above, practicing these same principles to really, really heal yourself of disease and to lead a long and healthy life. So goal of today, I really wanted to talk about, a long-winded answer. Like I said, I love to give all the science behind it, but basically start talking and having discussions with your practitioner about testing your fasting insulin and how you can start bringing that fasting insulin down. You will be amazed at the energy, the weight loss, the lack of disease, lack of need of medication the moment you start bringing your fasting insulin down. So message me, DM me if you have any further questions. I'm happy to answer any questions, and keep the questions coming. I love it.